I'm working as registrar in the Department of Internal Medicine in Jorhat Medical College, Jorhat, Assam. So today it's a very pertinent topic that we are going to talk about. And that is that about esophagitis. It's a very common topic that we get in our day-to-day practice, and it's increasingly becoming a very common problem among the general population because of many reasons that we'll discuss in the following discussion. So esophagitis, it occurs when the esophagus becomes smaller, and it main symptoms that come with the disease are difficulty in swallowing. There will be odynophagia, which we call. Uh, the patient will find very much difficulty in swallowing solids as well as liquids, and will feel pain in the center of his chest while he will be swallowing his food. There are many causes of actually risk factors that make a person prone to esophagitis. And these risk factors, besides, there are many. We have obesity, you can name one, which is very common in today's world. Then we can also tell about the pregnancy, which is also very common. Esophagitis occurs in these conditions because of increase in the intra-abdominal pressures, for which there is reflux of the gastric contents into the esophagus, which will cause inflammation of the esophagus and lead to esophagitis. Also, there are cases where we find in today's fast-paced world, there's abuse of many different kinds of drugs like alcohol, cigarette smoking. They also cause a person prone to esophagitis. Also, we have other cause of esophagitis, which we call as pill esophagitis. Pill esophagitis occurs because when a person consumes a pill or a drug in the form of pill without taking water. So it causes pill esophagitis, which is very much common with drugs like potassium supplements. Potassium supplements. Then we can say about bisphosphonate and antibiotics like doxycycline, mostly tetracyclines like doxycycline. So these are the causes which, with these risk factors, which will cause esophagitis. Also, you will find so in certain individuals where this esophagitis is commoner who have a lax esophagus. In other words, this esophagus and the junction between the esophageal sphincter, it is if it is lax, then we'll also find reflux of the contents into the esophagus, and it will cause esophagitis. So we have the problem with esophagitis is that there are different causes of esophagitis. Although the symptoms will be patient will present with the same symptoms, like he will present with the pain while swallowing. He will present with reflux of gastric contents. But we cannot pinpoint the esophagitis or the cause of esophagitis without doing an upper GI endoscopy. Upper GI endoscopy is very much pertinent in to diagnose the cause of esophagitis, because we can only label that as esophagitis only after the upper GI endoscopy. Also, it's a very important cause of esophagitis is ingestion of corrosive substance. Like people who we find many people in our clinical practice where they come with ingestion of corrosives like acids, like vinegar, or the alkalis like bleach. It might be accidental or it might be suicidal. So it will lead to a very severe form of esophagitis, and it will also cause stricture, esophageal stricture. So it's a very sad scene to see these patients who have either due to accidental ingestion or due to suicidal ingestion, they come with the causes of esophagitis, where the esophagus is very much inflamed, and even doing a upper GI endoscopy becomes difficult in these situations, as it might lead to rupture of the esophagus. So also we'll find esophagitis in infections like viral infections like cytomegalovirus, and fungal infections like candidiasis, candidal esophagitis. Candidal esophagitis is very much common in immunocompromised patients who are suffering from HIV/AIDS, or even we'll find that in diabetics, in candidal esophagitis. So the problem with esophagitis is that they can present with very common symptoms like heartburn, regurgitation, reflux, then pain during swallowing, feeling of foreign body sensation in the throat or the chest pain, retrosternal chest pain. But the very severe presentation of esophagitis can be huge upper GI bleed in the form of hematemesis, and that can be very much life-threatening. You will find continuous irritation of the esophagus by the gastric acid, hydrochloric acid. It will cause change in the squamous epithelium into columnar of the esophagus, and that will cause Barrett's esophagus. And it is a pre-malignant condition. It can turn into malignancy, and that can only be diagnosed after doing an upper GI endoscopy, where we will find pink tongue-like projections into the esophagus of pink mucosa of columnar epithelium. Also, there are other causes. A very common cause of esophagitis is eosinophilic esophagitis. It's very much commonly found nowadays, and mostly it is found in children who are suffering from any form of atopy or allergy. The problem with eosinophilic esophagitis is that it cannot be even diagnosed. Sometimes it is missed on the upper GI endoscopy, but it can only be diagnosed on biopsies. That too taken from multiple sites, which will show infiltration of the esophagus by the eosinophils. Although the symptoms will be similar, but you have to take the history of atopy. Also, there will be peripheral eosinophilia and eosinophils on in the biopsy specimens. So these are the different kinds of these are the different causes that will cause esophagitis. Among them, there's another cause which is the hiatus hernia. Hiatus hernia will also cause esophagitis because it will lead to same the contents of the stomach coming up in the esophagus because of the difference in the pressure between the esophagus and the stomach. So all these causes have to be treated different. But empirically, after we get a course of a patient with esophagitis, we have to treat him with a 8 weeks PPI therapy, 8 weeks of PPI therapy. If it resolves, it is well and good. If it does not resolve, then we have to go for the upper GI endoscopy. If we find that it is due to fungal esophagitis, then we have to treat it with uh, antifungals or the steroids. Then, if we find that it is viral esophagitis, then we have to treat him with the antivirals. If the esophagitis has turned into a stricture, then we have to do the dilatation of the stricture. Also, if we find that he is suffering from reflux due to any cause, it can be gastroparesis due to the diabetes or any other cause of reflux due to any lax esophageal sphincter. So then we have to use any prokinetic drugs. So these are about the drugs. Now, if we have to treat the patient, then we have to also give about the lifestyle advice that we have to give him. First of all, if the patient is obese, we have to ask him to lose weight. If he's a chronic smoker or an alcoholic, then we have to advise him against those habits. We can ask him to sleep with some pillows, with one or two pillows under his head, so that he does not have to suffer from the symptoms in supine position while he is sleeping. Also, it's a very good practice to let a person who is suffering from esophagitis to ask him to have his meal, that dinner, his dinner at least 3 to 4 hours before he goes to bed, so that the food does not get regurgitated into the esophagus. Also, these are the therapies and the lifestyle advice that we can give. But if the symptoms don't improve and the patient might be suffering from any surgical condition like a hiatus hernia or a lax esophagus, or esophageal junction, uh, then we have to go for the surgical options. Also, a very good practice is to have his drugs. If he is taking any potassium supplements, ask him to take the liquid form of the potassium supplements. If he's taking antibiotics like doxycycline or bisphosphonates, ask him to have that with a full glass of water, so that if the pill goes and gets stuck, the pill does not go and get stuck in any part of the esophagus or in any stricture, already formed stricture of the esophagus, where it will further aggravate the esophagitis. So esophagitis is a very common condition that we encounter in our day-to-day practice. Patients might come with vague symptoms like chest pain that might mimic angina. They can come with reflux symptoms, heartburn. They can come with problems of uh, swallowing, pain during swallowing. They might be afraid to have their food because of the pain. But with the proper lifestyle advice, with the proper medications, after an upper GI endoscopy, which might be necessary if the proton pump inhibitor or prokinetics fail to decrease the symptoms of esophagitis, we can diagnose the actual cause of the esophagitis and treat it with the appropriate antiviral or the antifungal or steroids like method dose inhaler of fluticasone or budesonide. And the response to the symptoms, response to the condition or to these drugs are excellent. And if there are any surgical conditions that might be causing the symptoms, then definitely we have to go for surgery. And nowadays there are different surgical options, even endoscopic options, which can be done endoscopically to treat the symptoms of esophagitis, to treat the surgical conditions. So, thank you for giving me this opportunity to say a few words about esophagitis and the symptoms and lifestyle advice that might be necessary to treat the condition. Thank you so much.
Thank you, sir. Thank you so much for your valuable time, sir.
Thank you, sir. Yeah, ma'am. Yeah, thank you, sir, for your detailed information on the topic. Thank you so much, sir. Sir, definitely লগ পাম মই থাৰ্ড বা ছেকেণ্ড উইকত যাম যোৰহাট